morning. Thank you for stepping into my queendom for another exciting episode of Queening with the Empress with me, your host, Patience Pet Piri. Our health system has been in the gutter, and that's a very nice way to put it, for many, many years, and COVID-19 has done absolutely nothing for us. If anything, it has turned a situation that was already bad to worse. On Monday, the 27th of July, 2020, social media was awash with leaked images from Harare Central Hospital of 7 babies that were stillborn after urgent treatment was delayed because of alleged staffing issues. Of the 8 cesarean section operations performed, we are informed that 7 of the babies that day were stillborn. And this proved too much. It's too much. I'm a mother. Look, I talk about my son at any opportunity I get. And I cannot begin to imagine what that is like for the families that experience that. But on the backdrop of all this, a group of concerned citizens came together and they thought this is too much to ignore. Therefore, they decided to take a stand and formed something called Empty Cradles movement. They have, within the past week, put out a statement, put out images, shared messages of what's going on, and put out a call of demand. And to talk more about this and their hashtag that they're running with, which is Sesilahla Imbeleko Mbereko Kumali, Stop the Bleeding, are 2 powerful women. We have Florence, who's a human rights consultant. There is Florence. And then we have Samatha Majoni, a full-time mother and a creative copywriter. Both of you are here to talk about Empty Cradles movement. Yes?
Yes.
Welcome. We just needed to be sure so that we can welcome you. We don't want you to be in the wrong Zoom meeting.
No, we are in the right place. Rather unfortunate topic, but in the right place.
Right. Okay, so let's start. I think to both of you, how did Monday impact you? The images that we saw, the red swaddled, I don't know if it was the babies or those clothes that we saw, the green ones that we saw, and then we saw, I think it was it's not a page of information, which had SB, normal, what, all that information, boy, girl, everything. And your mothers, your women, your citizens, how did that make you feel? Florence, I'll start with you.
Patience, the situation took me back to 10 years. I think it was 2010 when my Malugazana gave birth at Pilo Hospital. So, Esebeletile, we had to run around town looking for a bent needle. There was no bent needle at Mpilo that day for them to stitch her up. We ran around the whole town. We were lucky to be assisted by one doctor, which I will not mention. He had to go to his home and we bought the needle from him. So then when I saw that, I said, this is the situation that we're in that day. My Malugazana had to wait for us. Uguza atumwe, you know. So I'm just thinking, if Sasingatolanga, I mean the needle, what would have been the outcome? So then I said, maybe if I had stood up then and started talking about this issue, the 7 children would have been saved. But I kept quiet, and the situation has gone to unprecedented levels. I think that's how I feel. And then I said, no, I think this is the time for us to protect the ones that are going to come after this. Yeah.
Samantha?
Well, thank you for having me on your program, Peshi. For me, I think upon seeing those images, I was quite taken aback. For me, it wasn't the issue of what had happened there and then. It was an emotion of anticipation and lost hope for me. You know, being a mother of two myself, every pregnancy is different, every journey is different, but we all share that same emotion of loving this unborn child, preparing for this child, buying clothes, looking for names and so forth, you know? And then you get to the point now when you need helping hands to help you bring this new life to the earth. And it all falls to shatters. The whole dream just falls just like that. And it's a powerless feeling. I put myself in the shoes of these women who had to go through this trauma, going back home with empty hands, going back home to look at those madishe kugeze samwana, you know, that you would have bought, the first outfits that you want your child to wear, relatives calling in to find out kuti Jafamba say there is no makorokoto, agula amhlope, because there was nobody to help you. There wasn't any equipment to help you. So for me, it was quite a shattering emotion. And it really helped me understand how much of a gift life is, and how we take it so much for granted when it is all working out for ourselves, yet not realizing that somebody out there is not going through the same emotion because they've had a totally different experience. So for me, that image just shocked me back to reality. It shocked me back into thinking that have I been my sister's keeper? Have I been my brother's keeper with issues that have to do with maternal care and neonatal care? Because sometimes you feel it didn't happen to you, so you can be just like, shame, sorry, Shavo, and you just move on. But kushikarini, tomorrow it can be your sister, it can be your aunt, it can be your friend from school. And what are you going to tell them when they tell you, I lost my child because there wasn't a healthcare professional at the hospital, or they tell you there wasn't enough machinery? So sometimes we need to take ourselves into those shoes that we know we might never get there. We might be privileged not to get there, but nobody knows tomorrow. And you don't know the person that is going to be affected by this tomorrow. So I felt it was time we brought attention to something such as this, because this is literally a matter of life and death. If there is ever anything that we can take seriously in this life, it's matters to do with life and death. And this is one of them.
Wow. Florence, I will ask you, what are the current stats at the moment in the country of maternal and neonatal mortality in Zimbabwe? And is there any legislature like to support us in this anger?
Okay, thank you very much, Peshi. 2020, there is no, I've been researching, there are no statistics, I think, beyond the COVID. But we'll use the recent statistics, which are the 2019 statistics. The 2019 statistics reveal that in Zimbabwe, especially Zimbabwe ranks maybe beyond the hundreds of countries with the highest maternal and neonatal mortality. It's beyond the hundreds. And then secondly, we have about, in Zimbabwe, the rate is about 462 deaths, maternal deaths per 100,000 beds. Or mama abapupai when giving birth. That's maternal death that I'm talking about. So there are about 462 that die out of 100,000 beds. Then this figure came down from 614 in 614. That was in 2014. It came down in 2019. It was now 462. So we had a good strength towards reduction of maternal mortality. And then in terms of neonatal, we have about 39.9, which is about 40 deaths to 1,000. So 40 infants die in 1,000 beds.
Wow.
So it shows that it is a high number. And also when people are asked why do we have these numbers, a number of reasons are given. First of all, especially in Zimbabwe, it is the state of the health system. Our health system is going down. And also the demotivation among the staff. I'm sure you've had a lot of cases where people report to the nurses are treating us badly. Some, they ignore us and everything. So another one is demotivation. And also the issue that we have not been also not focusing on as a country is development of the health system. Surely, if you go to other hospitals, like even Ngasbukela on TV, you see the development in hospitals. Everything is technology now. But in Zimbabwe, we still use amabhuku to go to the clinic. We don't even have a computerized system. I have to buy an A5 to go to the clinic. Yes, I use Tengela loan. So those are the issues. So in terms of the legal legislation, the Constitution is very clear. I'll read a number, or I'll refer you to a number of sections in our Constitution that maybe people can read on in their spare time. I'll just hazard through them, not to bore you. But first of all, our foundation in terms of respect of human rights, it is important for citizens to know that it is the duty of the state to promote, protect, fulfill human rights. What do I mean by that? When I talk about protection, I'm talking about putting measures to ensure citizens are protected from any ills. When I talk of promotion, I'm looking at the state taking action, raising awareness on these issues, promoting health. How does the state promote the health? Giving people information, getting information and developing the system. When I talk about fulfilling is when the state takes action to cover the gap. If we are fulfilling, it means the glass is half full. We are making it full as the state. To say our citizens cannot be able to do this on their own. It is our mandate as the state to pitch in. That is the role of the state. So also, in addition to that, our Constitution in section 12, in subsection 12, it says the state must take all practical measures to protect the fundamental rights enshrined in chapter 4 of our Constitution. In chapter 4 specifically gives us the two rights that are very important to our discussion. First of all, section 48 talks to the issue of the right to life. This is a justiciable right. What do I mean by that? If I die in the hospital, somebody can go to the court and claim a retribution and claim a redress from the court to say, why did she die? How did she die? Somebody must be accountable. That is what it means. Section 76 of the Constitution says we have a right to health. It is clear. I want to read it. It is clear. Every citizen and a permanent resident of Zimbabwe has a right to have access to basic health care services, including reproductive health care services. No person may be refused emergency medical treatment in any health institution. The state must take responsible legislative and other measures within the limits of resources available to achieve the progressive realization of rights set out in this section. I want to explain the clawback clause, which says within the limits of available resources. Patients, is it possible for people to reduce maternal health? It is possible. We have countries like Japan, Singapore. They have 1 death per 100,000.
Wow.
So I just wanted to give an example to say it is possible. We're not talking about something that's impossible. It is possible. We have Japan, we have Singapore, we have Iceland. Those are the examples where women don't die when giving birth. Why? It is because they prioritize. They don't hide behind such clauses that say within limited resources. They prioritize and say, we want our mothers to give birth in a safe environment. We want our children to survive because they are the future. So the last one that I want to talk about is the Section 19 also speaks on children. Section 19, subsection 19 of the Constitution. It says the state must adopt policies and measures to ensure that in matters relating to children, the best interest of children concerned are paramount. The state must adopt reasonable policies, measures within the limit of resources available to it to ensure that children enjoy family or parental care and appropriate care, shelter, basic nutrition and health care, social services. So there are about many rights in the Constitution that support the issue that we are talking about today, not only one. So as a country, we are not poor.
No, we are not. Far from it.
Yes, we are not poor. What does this mean? If we did not have the money, just this month, last month, Mutuli presented his midterm policy review. Yeah, he never said he needs a supplementary budget, Patience.
Yeah,
he said we have money. He was going to environment, take from ama institutions and put in other budgets from other institutions and put it as. So to me, maybe we have the money to put to e-health. So the countries that have been given example of our Singapore, they do not have a mineral wealth like us. If they can prioritize and ensure ukutobo mama bayapila, I think we can. I think we can. Thank you.
Those figures, those figures are, yeah, we need to do more. We need to do more. Samantha, I will come to you and ask you, we are talking about empty cradles today. I would love to understand the idea behind it, bringing it together, and was it difficult to get like-minded people to come together for this cause?
Okay, thank you for your question. What I can say is the Empty Cradles movement is a collective of concerned citizens from different sectors, different cities, political parties, age groups, religion, you name it, who have just been troubled with the deaths of women and babies in our healthcare systems. It's as simple as that. It's a matter of raising awareness with regards to what is happening in this whole process of maternal care in our healthcare systems. You know, even in the animal kingdom, you know, even animals know to protect their pregnant species. But we are failing in Zimbabwe. We are failing to prioritize the giving of life, such that you can even say maternal wards are understaffed or ill-equipped, and that's just we can't accept that. We can't then say we are proudly Zimbabwean when we are failing to regenerate life and the next generation that will then uphold our identity and our origins. So that said, it wasn't a difficult matter to have like-minded people jump onto the idea, because everybody has a mother. So one way or the other, you know the connection, you know the depth and the importance of the life-giving process. So we've had a lot of support. We've even had some men, you know, asking to be part of the movement, because this doesn't concern women only. There are men also who are very much affected when a loved one loses a child, or it can be their spouses, it can be their relatives, you know. So this is a matter that is cutting across everybody. It's a matter that is not going to be selecting on where you live or how you grew up or you know, your academic qualifications. because at the end of the day, tapa labor, payaka, it's a totally different story. So we are all equal. So we need to then be that collective that then asks these pertinent questions, because if we don't question such important issues such as this, then nothing else will matter, because Ndiana chararama upenyu wachona wekuzoita enjoy the things that you're fighting for. Mubani, agula. We are letting our systems deteriorate to such an extent that we don't even have official statements or opinion leaders talking about it anymore. It's not so much of a hush issue, you know? So I think the collective managed to gain momentum so quickly because it is an issue that unifies us. Life is an issue that unifies all of us. So that's what I can say.
Your statement, I did mention that you've put out graphics and the statements that a statement that has gone out. Can you briefly share what the statement is and tell us what are you demanding and who are you demanding it from? Because when I read that statement, it's a demand. So maybe just a quick just give everybody just a quick brief of what the statement is and who you are demanding from.
All right. So what I'll do is I'll just read it, because if I say it, I'll go too much into details and be emotional about it. So I'll just read it because it just cuts to the point and it's more understandable like that.
Okay.
We are frustrated by the unnecessary continued loss of young lives and mothers due to the negligent or the neglect of basic healthcare services in our country. We're concerned by the government's silence and inaction at the perennial industrial action against the negligence of the health sector and its workers. I'm sure we all know that the workers are very crucial to the whole system, and thereby ignoring them also cripples the sector. And we're also troubled that the government has been silent on this issue, such that we have a need of urgent primary maternal care and healthcare provision as of now. So we therefore demand the government uphold Section 76, subsection 3 of the Constitution of Zimbabwe, which clearly states that no person may be refused emergency medical treatment in any healthcare institution, which is what is happening. We demand that 15% of the national budget allocation be directed to health and childcare as demanded in Abuja Declaration on Healthcare, which Zimbabwe is also a signatory to. We call on the government of the Republic of Zimbabwe and its various arms and the Ministry of Health and Child Welfare, Ministry of Women Affairs and Equalities, Stembi Sonyoni, and United Nations Resident Coordinator for Zimbabwe, Mario De Vallo Ribeiro, and Her Excellency, the First Lady of the Republic of Zimbabwe, and the Chairman and Parliamentary Portfolio Committee to pay attention to what is going on in our health systems and speak up and take action about it, because at the end of the day, we have people in power. We have people sitting in these chairs who hold these positions to protect the citizenry. So we are the citizenry calling out these people in power to do their duty and do their due service to the people. We also, we call upon the Chairperson and Parliamentary Portfolio Committee on Health, Dr. Ruth Laborde, and Zimbabwe women parliamentarians to immediately declare maternal and neonatal mortality a national disaster and allocate adequate resources to avoid unnecessary deaths of women and babies. We need to hashtag stop the bleeding. We declare that no woman should die whilst giving life. We declare that every baby will be saved. We call upon all policymakers in Parliament to address this issue as a matter of urgency as part of discharging their representative role for the constituencies that they represent. We declare that women and babies' lives matter.
Yeah, okay. So listening to that, you've already addressed it to those people. I will then ask Florence, has there been any response?
Oh, thank you very much, Peshi. There has been a lot, like Samantha said, people are soft to this issue. We've received stories from women voluntarily. We're also receiving support, like she said, from men to say we want to be part of this movement. And we're in a process of sending out some petition and some letters to relevant ministries, like she's saying. And through some partners, we are having on Wednesday, I think, Wednesday, what's the date on Wednesday?
On Wednesday, that's fine.
Yes, Wednesday,
Yeah.
the 5th. We are going to be hosting an indaba through the WhatsApp platform with parliamentarians, women parliamentarians, to discuss the issue. We are hoping that they will take the issue to their peers. And maybe also in our advocacy, in our media advocacies, we are hoping the people that we tagged, the gender commission and everything, we're hoping that they're going to respond. We're going to follow them up maybe with letters. And we're also touching on women that have men in powerful positions. You know, when I did peace, there was this, there's this thing that they use, they call it the bedroom plate. So they say during wars, women would do their advocacy through cooking the best meal, daddy's best meal, and then they cook, they put it in that nice place, they put it in the bedroom. So when the man comes, they give the men the plate with the favorite food, and then advocate for what they want. So we are,
as he's eating his delicious meal.
Yes.
You are advocating.
Yes, his delicious meals. That's when advocacy works. So we are also looking at these women that are wives to policymakers as well, to take the issue to those men, to ensure that even at parliamentary level, even at a portfolio level, those issues are prioritized, because we have to remind them. Some of these issues, people do not talk about them because they do not know, but because nobody reminds them about these issues. So we don't want to blame a lot. We're saying they've forgotten maybe. Let's remind them. So we're calling about every woman, business women, men in higher position, the wives of doctors, of medical, what, they should be telling their men to ensure that maternal mortality is reduced and neonatal mortality is reduced.
Okay, I hear that. And then I would love to find out also this issue as it is, who is responsible? In your opinion, as Florence,
it is clear.
Who hold responsible for this tragedy? Because it is a tragedy. It's I know when we're talking about 7 babies, but that's just the tip of the iceberg. I'm sure if we go around in the 10 provinces and we go through paperwork, there'll be more that can be unveiled. Who do you hold responsible?
If you remember when I was presenting on the legal frameworks, when I was speaking about the duty of and the responsibility, it is the responsibility of the state to promote, protect, and fulfill socioeconomic rights, as clearly stated in the Constitution. Who is the state? The state is the executive, the legislature, the judiciary.
Yeah.
The executive is the administrator of this country. Yeah. So when they are the administrator of this country, they should allocate, as any administrator of any institution, administrator of a shop, and allocate according to the needs. So the state has the duty to promote, protect, and fulfill the health rights of the citizens. So what then does the state need to do is to mobilize funds. How? Through a lot of ways. Limit corruption. We want to see the judiciary standing up, prosecuting those that steal public funds, so that they go back to where they are allocated to. Yeah. We expect the parliamentarians to be the bigger eye, the oversight. Ama Googles are 5 frames when it comes to service delivery. They should be protecting the citizens and demanding, and the committees, parliamentary committees, they should be doing rounds and monitoring the situation. We shouldn't be here at this stage where hospitals do not have toilets if people were doing their job.
Yeah.
What were people doing, especially the parliament as the overseer? What was it doing? So we need to see the state standing up and protecting the citizens. Yes, we have citizens that donate. It's fine. But ungaba ngubaba onjani utshone egcinela abantwana ngumakhelwane? You understand? You also have to plan.
Yeah.
Umakhelwane kakunika udoma seliphelile. Akhona ukucela i-2 kg komakhelwane. You understand? So the state has to stand up and take its role. It is the role of the state to promote, protect, and fulfill human rights.
We have unfortunately lost Sam. Let me try and bring her back on. But while we wait for her to come on, my question would be, what next for this movement? What's next for it? What's happening? And if someone is watching at this moment and would love to be part of the movement, where do they find you? How do they join in? What happens?
Thank you very much. I'll give that to Samantha.
Oh, now she's back. Hi, Sam.
Yeah.
Welcome back.
Sorry, I got connected.
No, that's fine. That's fine. So the question that we had asked, I will ask you, in your opinion, who do you hold responsible for this tragedy?
Well, to be honest, first and foremost, I hold every ordinary Zimbabwean accountable, first and foremost, because we have allowed a situation to deteriorate right in front of our eyes. We have waited for shocking images first to then shake us up into action, into trying to find out what's going on. When in the past, there are more people who maybe we didn't see their pictures on social media, who've gone through trauma, who've had to deal with an ill-equipped health system, and we just go about it quietly because we have accepted that it is our situation in Zimbabwe. So I hold every ethical human being here in Zimbabwe who knows that their voice matters, that we have allowed a situation to get to the gutters, like you said in the introduction. So first and foremost, it's everybody's responsibility. It's everybody's responsibility to be each other's brother and sister's keeper. So first and foremost, that's where the responsibility lies. Secondly, I want to hold responsible the people that we have elected into power to represent us in issues to do with health and well-being. We know we have a lot of people there with powerful CVs who could have helped, who could have talked about it, who could have given advice, who could have made noise about it, but we are just accepting kuti ndozvavepo ndozvazviri muZimbabwe zvinhu zvakaoma izinto zomile Zimbabwe, and we just turn a blind eye. What are you doing in that position of power that you were elected by the people to represent? It is your responsibility to represent. So if you are not doing that which you have been put into office for, what are you doing in that office? Thirdly, I want to hold accountable opinion leaders. We have influencers, we have celebrities, We have people who masses listen to. What I'm saying, Ninisa Samantha, somebody might not even listen to it. They'll just flip it off with utin.
Yeah.
But we have people who, when they even cough, it's 1 million hits on YouTube. Why are you not talking about children dying in hospitals?
Yeah.
Why are you not talking about it? Why are you not tweeting about it? Why are you not asking your fans what they think about it, what they are doing in their own spaces to improve their situations? Because if we have this messiah mentality, it means we are always going to be waiting. We need to take responsibility, but our responsibility has its limits as well. So sometimes you just talking in your personal capacity as an individual, uri munhu wosha ko muZimbabwe kuti naiveduwe zvaitwa seiko tinobvunza ani, it means you're going to be pointed to an office. Waenda ikoko obvunza zvichidaro. It's a chain reaction. We cannot wait to have people come to save us. We need to start somewhere. And what better place to start than the health sector? Because everybody needs a functional health system. Everybody needs professionals to look after us when we are admitted in hospital or we are going to clinics and so forth. So it is everybody's responsibility, unfortunately or fortunately, but this matter is everybody's responsibility, men and women alike.
Wow. Okay. I hear you. I was asking when you came back on, I was just asking Florence, what next for Empty Cradles movement? What happens next? Now that you put out the letter of demand, you've addressed people, Florence said you're going to have a conversation with maybe policymakers, and what next though? What do we expect to see? What do you hope happens next? And if someone is watching, how can they be part of it?
I hope what happens next is action. After we have raised alarm, after we have talked about chichirukutinet, the next thing is action, collective ideas on how can we go about it? How can we help? How can we improve this situation? You know, sometimes we feel like we are powerless, but collectively, we have so much power. Imagine if all the women who have experienced trauma spoke up about it. Imagine if every woman who hasn't been properly helped at a maternity ward just writes a note or says her story. Even if you're anonymous, you know, it helps bring a perspective to the situation. Because for somebody who has not been in a maternity ward, they might just be saying, what hogwash is this person talking about? But when you have heard it as a story from somebody, it will compel you to action. I mean, an example is we saw these pictures and here we are as a collective. I tell you, the reaction is so overwhelming because it needed just somebody to start and say, can we talk about this? Can we find out who it is who is responsible? Can we write letters to them? And after that, we follow up. We want accountability. We want transparency. We know there are funds that are allocated to help in such matters. Where are the funds going to? So the next thing is the action. We need to follow up. We need to find out what is it that is missing. So far, we just know it's a lack of infrastructure or lack of motivation from the healthcare sector, right? But that's just an umbrella term. What can be done? We know that there are nurses' demands. What has been done with those nurses' demands? We know that there have been outcries by doctors, hospitals are ill-equipped. Then what has happened after that outcry? We have this tendency of then just making it a fight about doctors or a fight about nurses or a fight about, you know, putting people in brackets. But then in this issue, it's a fight for everyone because we all come from families. We are all part of a family unit. So it's everybody's responsibility to take action. Ask the pertinent questions. If there's a petition that is talking about health and you know you need to sign it, sign it. if you know you are financially able to help everybody, people are writing stories, people are trying to do follow-ups, trying to do videos for these women, you know the skill sets that you have, you know the finance that you have, you know the influence that you have. You know the prayer power that you have. You know, let's not sit back and wait for other people to do something, because they'll also sit back and wait for you.
Wow. Florence, I think in closing, do you have anything to say for somebody who's watching, a call to action for someone who's watching?
Just to say, this is not Indosi Kangelela next door. It's a visitor to each and every home. So like my colleague Samatha has said, whatever action you can do, if you have a powerful friend that you think can help in changing, if you have a message, if you can write a letter, if you have anyone, or if you are somebody that can make a change, please start making that change in your heart, in your garden, in your field, wherever where you are. Let's protect our mothers and our children, because tomorrow kungaba nguwe. So nobody is clean, nobody is immune. It's just like the COVID that we are in. Nobody is immune. That is the maternal health issues and neonatal health issues. So take it as your own, act as your own. I think that's what I can say.
Okay, Samantha, so where is there social media pages? Where do people reach you as MT Cradles?
Okay, so since this is something that it's in inception stages, we currently have a Facebook page, MT Cradles. So I think it's a good starting point. I mean, Facebook is a platform that most people have access to. We start from there. Let's come there. Let's discuss the topic, you know, let's have your ideas. How do you think we can go about this issue? Because as it is, none of us is an expert in this matter, but we're all just affected, and we are touched, and we're bringing whatever that we can to the table to make that difference. Kanzatu, it will make a big difference. So if people can come to our Facebook page, MT Cradles, we start from the community, we discuss the issue, and we see how best we can organize ourselves according to our skill set, according to what we have to offer, according to our cities and places where we stay, so that we know we have outreach, we need information, we need data capturing, so that even when we present our issues to the higher ups, you know, we have the statistics to back it up. So we cannot dream up such things. We cannot dream up some people's experiences. We need you to come to the table to share your experiences. What is happening in your own community? What is happening in your own health facility? You know, we need to have a strategy of building this movement until we get the results that we want. We cannot be at the terraces anymore.
Thank you so much, Florence and Samatha, for coming through to Queening with the Empress and lighting this fire. I wish you the best as you champion this movement, and that there's a change and figures drop and more lives are saved. And like the statement said, that no child or woman should die, you know. So thank you so much for that. I would love to give my royal thoughts for today. As you know, like I did say when we began, I am a proud mother of a beautiful child, and I gave birth in 1999. And when I went to give birth, the doctors then were on strike, and I had to be assisted by junior doctors who, there was an issue there. But to think that almost 21 years later, this thing is still going on. I survived it. I don't know how many people survived it the way I did. I still carry the scars of what happened to me then, and to think that now it's still happening in our hospitals. And to be pregnant is an emotional thing. Preparing to give birth is a big thing. So I can only imagine what those mothers are going through, because those that may not know will be asking them, congratulations, is it a girl, is it a boy, only for them to constantly relive that trauma. So I want to say, I think we all are responsible. We all need to raise a voice. We all love our Zimbabwe. We've been going through a phase where we are hashtagging everything. We are hashtagging everything. Zimbabwe lives matter. Zimbabwe will rise again. Everything. We've just been hashtagging. And I really hope that Empty Cradles and the work that they're doing will call people to rise up. It will push so that no other woman has to experience such pain. No other child has to be lost. To see that image of those, I don't know what they call them, those hospital, I don't know, material ripped up, and to know that it's supposedly a little bundle of joy, which is now bringing so much pain because of many other things: infrastructure, staffing issues, finances, sanctions, or whatever. All these excuses that we give do not bring comfort to those families that have lost their loved ones. So I think maybe we really need to look deep into ourselves and question the people that we have representing us. I call them shiny suits. To question those people that sit there and say, I am here representing patients, I am here representing Florence, I am here representing Samantha. Who are you really representing? Because if you're truly representing me, please know that I want to have healthcare. I want to be able to access healthcare. I want to know that if I or my sister or my niece or anyone should go and do that, they will come back home safely. So from me and everyone here, thank you so much. Please remember to stay home, to stay warm, to stay safe. And more than anything else, don't forget to share or to subscribe and to like Site ZW so that you are kept right there when the news happens, because that is what Site does. We are there with the news. So thank you so much, everyone, for watching. And stay safe till next week. Bye.